Jeremy Taylor is the Advocacy Adviser for the East Africa region of the Norwegian Refugee Council. He joins us now from the Kenyan capital, Nairobi. Hi, Jeremy. Thanks for speaking to us. First, tell us what you're actually dealing with and seeing on the ground there in Kenya. I mean, how much are people actually at risk, and are authorities responding appropriately? I can't imagine tear gas would feel necessary at this time.
Well, as an international NGO, our focus is on refugees and displaced people. So I can't really speak to the actions of the Kenyan government, though I can say they have been very aggressive in their attempts to prevent and mitigate the spread of the virus. But from our perspective, our focus is more on looking at the numbers of what we would call vulnerable people across the region, across the East African region. There are almost 14 million people who are either refugees, internally displaced people, returnees, or asylum seekers. And so we're calling on governments across the region to really include these vulnerable groups in their planning and their contingency measures for the spread of this virus.
Right. Africa-wide, though, you really are seeing similar issues across the continent. They won't get fixed overnight. So how much worse could crumbling infrastructure, particularly in the health sector, actually make problems bigger across the continent?
I think it's certainly a concern. I mean, I think you can look at a number of countries across the continent whose health services are strained. And the prospects of this virus getting into communities where access to water is limited, where the ability of people to isolate and to distance themselves from other people in the same way that we're asking people in the West, for example, to do, is difficult. In communities where people are living very close together and access to these services are limited, we have to say that it is a massive concern. And for that reason, organizations like ourselves are trying to put in place as many measures as we can in the communities where we work to try and prevent and then ultimately mitigate the impact of the virus. And this includes measures around improved access to water, to soap, the distribution of soap, hand washing facilities, and also putting in place, especially in refugee camps and internally displaced settlements where we work, trying to put in place spaces where people can be quarantined, and just to try and reduce crowding within these communities, because these things, as we know, are now considered the best mechanisms to try and reduce the likelihood of the virus spreading.
Right. So if there are any potentially positive outcomes to this pandemic, it could be that the urgency of containing and stopping the spread might be sudden investment in the infrastructure that's been so lacking in the refugee camps, including access to clean water.
Absolutely. I think one of the advantages that Africa does have is we've had a little bit of lead time in the sense that we're several months behind sort of the peak that we saw in China. And this has allowed authorities to put in place plans. It's allowed authorities to try and also activate plans that might have been in place previously for other epidemics, Ebola being one of them. So there are a number of governments that actually do have contingency plans. They do have there have been ideas that have been thought about and various mechanisms that have been put in place that can now be activated. And so this lead time matters. And I think it's resulted in a lot of governments across the continent, in fact, being quite aggressive in terms of closing borders, closing airports, reducing travel, putting in place various things like curfews and lockdowns, whilst the total numbers of people infected are very low. And so that's hopefully getting those measures in place before you see the spike of actual confirmed cases.
Tell us, I mean, though, in the camps and elsewhere, really, what you're up against on the most fundamental level, and that being education, making people on the ground actually aware of what the risks are, stopping misinformation about how this virus spreads and who's vulnerable to it, who could be infected. How much of a challenge is that for you, and what have you had to do to make sure the right information gets to these people?
That's a very good point, and I think it's a key part of what we normally carry out through our what we call our WASH, our water, sanitation, and hygiene programs, is awareness raising. And so we're looking to ramp that up in terms of raising awareness, not just about the importance of hand washing, but around how this virus spreads and to inform people in terms of how they should be behaving. But it's also about training our own staff and putting in place measures for ourselves in terms of how we prepare our staff, how we train them and equip them with the right protective clothing and all these sorts of things. So information is an incredibly important part of this. And I think a number of governments are also looking at ways to try and counteract fake news and misleading information that's spreading, especially in social media, around how the virus is being spread.
Okay, Jeremy Taylor, we'll leave it there for now. Thank you so much for that from Nairobi.